Hi, I'm Marie-Louise.
And I'm Dr. Coopoo.
And you're watching Base Care with Best Made Medical Scheme. These informative mini episodes give parents vital information to use in case of an emergency. With decades of experience and their wide network of healthcare professionals, Best Made knows you want what's best for your family. Spend a few minutes with us today as we explore the importance of CPR. Dr. Coopoo, at what age can a child learn CPR?
As soon as the child is old enough to understand the instructions of CPR, they can do it. So even a kid from 7 onwards, I always recommend that families go for basic life support courses. If you look at the Resuscitation Council of Southern Africa, on their website, they offer a lot of courses. So that's how you can equip yourself and your children. For younger children, just teach them the phone numbers of the emergency services and how to recognize if someone's fallen down. And even that can save a life.
Okay, so when will we actually then perform CPR on a child or an infant?
Okay, so basically any child or infant that you find unresponsive, or you witness them collapsing, or they struggling and gasping to breathe, that's when you'll do CPR. But just always anticipate when a child is going to get sick and don't leave it until they do crash. So if you have any concerns about your child, if they're not drinking, they're sleepier than usual, they're vomiting everything, they're breathing fast, help them and take them to the doctor before you need to do CPR.
So prevention is actually better than cure?
Most definitely.
Well, let's get into the practicality. Can you show us how to do CPR on an infant or child?
So there's 2 things that I say you need to remember. Your triple S and your ABC. So your triple S stands for safety, shout, and stimulate. Safety is when you check the immediate environment. Is it safe for you and the child? If the child is collapsed on the road, move baby off the road so that you can be safe and start resuscitation. Shout is call for help, either with the phone, use a speakerphone function, or you get someone to go and call an ambulance on your behalf if someone is around. And then the last thing is stimulate. So you check if baby is responsive. You can do that by gently shaking the arm, tapping the child, speaking to them. And if the child's responsive, they should open their eyes or groan or move. So if there's no response, then you know you need to go into the next steps of resuscitation. So that's your ABCs. A is airway. So basically make sure that baby's head is lying straight. Don't let the neck be flexed because then you won't get air into the lungs. Secondly, you're going to start breathing for baby. So if it's a small baby, you're going to position their head and put your mouth over their nose and mouth and create a seal. In a bigger child, you pinch their nose and just put your mouth over their mouth only. Then you take a breath and breathe out so that you see the chest rising. Breathe out for about a second. If the chest is rising, you know you're doing the right thing. And then let the chest go back to its normal position before you give the next breath. So you give 5 of those breaths. Then C is circulation. So if the child hasn't responded to your 5 breaths, then you need to go into chest compressions. The technique varies about if the child is a baby versus an older child, but the gist of it is the same. You need to compress the chest fast, so at a rate of 100 to 120 beats per minute. What you have to do is think of a song in your head that is at that tempo. I often use the song Staying Alive. So sing that in your head and you'll have the tempo. And then you know you're doing it the right speed. So the techniques in terms of babies versus older children, with babies you do a hand circling technique, or you can use 2 fingers to do compressions. In an older child, you can use 1 or 2 hands to press onto the breastbone as if you were doing CPR on an adult. That whole period is a cycle. After 5 cycles, reassess the child. If the child's unresponsive, you continue, and you continue until help arrives, the child is responsive, or you are too fatigued.
Thank you so much, Dr. Coopoo and Best Made for medical aid that is personal. Join us for more mini episodes in the Best Care series, where we tackle pain, fever, and water safety. Practical tips for you at your fingertips.